These are the heartbreaking comments from a health worker in Wales just a few days ago after receiving PPE from Tarian Cymru. The pressure on staff is ever growing. I work in a red zone, which essentially means we are a COVID ward. The advice on what PPE we are allowed changes daily. In fact, it can even change within the same day, depending on who you speak to. A lot of the staff speculate that the advice given to us is dependent a lot on the availability. The aprons we are given to wear are sleeveless, and most of them break while you're trying to get them on as they're so cheaply made. We are told surgical masks will protect us, yet staff are going off weekly due to contracting the virus. We have the constant reminder that some don't even make it home. Hospital managers keep more of a distance from the wards. The porters won't even set foot on a red ward, yet are on the same pay scale as some of the health carers risking their lives. The ward staff are now left to carry out the porter duties on the ward. This, amongst other things, involves transferring patients to the mortuary transportation trolleys. For those who know this and how it's done, this isn't an easy task and has left some workers traumatized. The thing I find the hardest is fighting natural instincts. Not being able to hug a person who has just lost their partner of 70 years has been the hardest moment of my career. Not being able to hug my own child has been difficult enough, but this broke a little part of me. After each shift, I have to sit in my car for 10 minutes to debrief and reflect in my head. There have been many times I'm not sure how I've held it together for 12.5 hours and have broken down sobbing alone at the end. Because I have vulnerable people at home, I've been isolating away from my family. Isolating from my family so that I can try and help reunite other people with theirs. I strongly feel if we had the correct PPE, not only would less frontline workers be dying, but their emotional well-being would be more looked after too. It seems the government encourages the public to clap so that it drowns out the noise of those crying for better protection, so they can be with their families. And they call us heroes so that when we die because of the lack of PPE, we are honoured for our sacrifice, rather than they stand up and admit they are the cause. You can help the situation by raising funds so that more PPE can be distributed. Fundraising ideas are on the Tarian Cymru website. Please share this message so that the voices of Welsh health workers are heard. Thank you very much. Diolch o galon.